Hello, I am Dr. Kodlady Surendra Shetty, consultant spine surgeon at Spine Care and Ortho Care Hospital, Magdi Road, Rajajinagar, Bangalore. So, when there is a spinal instability means the spinal cord or the spinal column gets unstable. Suppose if you take a flexion and extension X-ray or if you do a bending X-ray, then you see one vertebra moving over another vertebra, then we call it as an unstable spine. So, in such cases, we have to fix that. So, there are various methods to fix that. So, one is this Lumbar Interbody Fusion, Transforaminal Lumbar Interbody Fusion, TLIF in short. So, here what we do is, we put screws onto the upper vertebra through the pedicle. So, there is a structure called pedicle in every vertebra. So, one on either side. So, upper vertebra, you put a screw, lower vertebra, you put a screw, and same thing on the opposite side. So, once we put the screws inside, then we remove all the disc material which has come out and release the nerve structure. And in the disc material, wherever the disc is there, because we are emptying the whole of the disc, we put bone graft into the disc space, and afterwards we put a cage, regularly a titanium cage or a PEEK cage. PEEK is a plastic material, so either a PEEK cage or a titanium cage, and we fill bone graft inside that cage and put in between the vertebra. So, interbody fusion, in between the upper vertebral body and the lower vertebral body, we put the cage and we also put the grafts, bone grafts, so that gradually there will be a union between upper vertebra and the lower vertebra. So, it gets fused into one. So, that is helped by the screws which are putting behind, and we put the rods in between the screws so that whole thing becomes one piece. Two vertebra before which are unstable, they become one piece, and ultimately, that is earlier it is mechanically held by the screws and the rods, and later the bone develops in between the vertebra and that becomes a solid mass and becomes totally stable. So, the indications are the back pain. Chronic back pain is the main indication. Chronic back pain where there is instability. So, when we take a bending X-ray, flexion or extension X-ray, and if you find that there is a instability, in such cases, then we do this fusion. If it is already stable and though patient is having back pain, if the spine is stable, then we will not do this type of surgery. So, then such cases they may need a different type of surgery like spinal decompression, or sometimes they don't need surgery at all because the cause of the back pain is something else like arthritis or infection or something like that. So, in such cases it is not indicated. So, it is indicated mainly for the mechanical back pain where there is instability.